Aloha, my name is Martha Clopin, and I'm so happy to be here today to talk to you about Medicare. My series, Medicare Answers in Minutes, will help you explore the world of Medicare. And I'm so happy to be able to come into your home because we're in a pandemic and now it's not really safe for people to go out unless they're getting essential things. So until that changes, if you want to explore any of these lessons on Medicare, now you can do it in the convenience of your home. We're going to start the series with my ABCs of Medicare. Medicare has many different parts, and those parts start with the ABCs. Many times we didn't learn about Medicare in elementary school or high school or college, and that's because Medicare doesn't start for most people until they're 65 years old. So of course you're far, far away from that when you're actually in school. But now is the time to learn because we have so many people who actually are turning 65 every day and qualifying for this very, very valuable benefit. Now, I share with people when I talk to them, whenever you talk to someone about Medicare or you listen to someone, make sure they have your specific information because Medicare is different depending upon your own unique situation. So it's very important to understand Medicare, there's no one size that fits all. So please make sure you don't make any decisions based on some of the information I may share with you today. So the first thing I want to start with is those 4 parts of Medicare. Normally when people have insurance, we either have insurance through parents or if we get that first job, those benefits may be insurance benefits. So we just learn that we have insurance, we get a card, and we go to the doctor. Well, when it's time for Medicare, Medicare is broken up into parts. There is a Part A, which takes care of hospital benefits. So if you're hospitalized, the benefits will come under Part A. There's also a Part B to Medicare, and Part B takes care of medical services, things like going to the doctor, having lab work, x-rays, things like that. And then there's also a Part D for prescription drugs. Many times people need to pick up medications, and Medicare calls this Part D. And then there's one more part to Medicare. I didn't skip a letter. It's Part C. And the reason that I use C last, or I cover C last, is because C covers your Part A, it covers your Part B, and it can also cover your Part D. Most people think, but what does C actually do? Well, C, I tell people to look at as a complete package of all of your A benefits, your B benefits, and your D benefits. So Part C doesn't really come with anything except a comprehensive list of benefits and services that will help you get the most out of your Medicare. So very important to understand the parts of Medicare because it works differently than the insurance that you have when you are younger. So I have a slide, it's showing the Kaimuki High School graduating class of 1969. And the reason why I like to talk about the Kaimuki High School graduating class of 69 is because I met them several years ago when they were all turning 65 and we became really fast friends. So each year prior to the pandemic, they actually invite me to Las Vegas, and we actually do a Medicare update in Las Vegas every year. So this year we'll do it by Zoom video, and none of us will be in Las Vegas, but I just love that class of 69, and I love that when they reached out to me when they were turning 65, which was several years ago now, we've remained very close friends. Now, one of the things I like to do when I talk about Medicare is I like to give everybody an understanding of why this benefit is so important and how it's grown with us over the years. Well, Medicare actually was signed into law in 1965, but the very first cards went out in 1966. So what kinds of things were going on in 1966? Well, I won't talk about inflation, but the Dow Jones Industrial Average, that's the stock market that a lot of people follow, it's close to 30,000 points right now. And look at it, in 1966, it was 785. That means it grew a lot, and if you had invested in 1966, we probably would be talking about your billions of dollars right now. But back in 1966, the stock market was at 85. The average cost of a new house was about $14,000. When you think about the average of a cost of a house today, it's grown a lot more. So many things have happened since 1966, and one of them was this Medicare insurance program came around. Also, a gallon of gas was 32 cents a gallon. So 1966, prices were a lot lower than they are today. Even a car was about $2,600. And again, if you find a car for $2,600, it's not a brand new car. And here at a time like this, they decided to start this Medicare program because before Medicare insurance started, if you needed a surgery, if you needed to see a doctor for some type of catastrophic situation, you actually had to rely on friends and you had to rely on family. If you were, older and no longer working and you didn't have coverage through an employer, then you had nothing. Maybe your savings, which could be wiped out. So Medicare insurance is a very valuable benefit that since 1966 has really taken very good care of people, but this is one of those insurances that people don't know a whole lot about. So let's look at the number of Medicare beneficiaries in the US and Hawaii today. Well, in the United States, we already have 59 million people on Medicare. 59 million. In 1966, there were two people. One was former President Harry Truman, and the second person was his wife, Bess. So from two people in 1966, the 59 people in the US today, quite a lot of growth in Medicare insurance. But let's look at Hawaii. In Hawaii, we have over 250,000 people who now have Medicare. So that's why I always say it's really time to learn about Medicare, because with 250,000 people right here in Hawaii with Medicare, probably someone we know, either our grandparents, parents, or maybe even some of our closest friends may be just about getting ready for Medicare or already there. So it's really important to have an understanding of how this very valuable Medicare insurance works. Now, Medicare can be like a maze to many people. A maze. They don't know really where to start. They don't know where to go. And the reason for that is Medicare does not have a physical office for you to visit and sit down and talk to them about your unique situation or whatever your situation might be. Maybe it's routine, maybe it's not unique, but you have to actually contact Medicare by phone when you talk to them about your situation. So that's what makes it a little bit of a challenge, and that's why it's so important that you learn about Medicare. Now, what is Medicare again? Medicare is broken up into parts. We covered those earlier, but two of those parts, Part A and Part B, are known as Original Medicare. Original Medicare Part A and B. Then there's also the Part C plans, Medicare Advantage, and sometimes people have Medicare alongside of their retiree insurance. Maybe they were working for a company, and one of the benefits of that company is when you retire, we will continue to give you insurance. When that happens, you get insurance from your company, but that will work alongside of Medicare. So it's not just the retiree coverage alone. And then there's RX coverage, also known as prescription drug coverage. And again, those are the parts of Medicare. Now, people qualify for this coverage if they're 65 and older, and also at any age with disabilities. So I've met people, the grandparents have Medicare, their adult children, maybe there was a disability and they have Medicare, and then even an infant child. I came across a family where there was an infant child, adult parents, and grandparents all had Medicare coverage. So some people think Medicare is only due to age, but it's also due to disability. So very important to understand that, again, 250,000 people in Hawaii have Medicare. Some of them qualify because they turned 65, and others because they have a disability. Now, when you're applying for Medicare, that's also a little bit tricky, because if you are receiving Social Security benefits, which come earlier than Medicare insurance, your card will be automatically sent to you. But for people who decide not to pick up Social Security benefits, they actually have to go through an application process. Those forms have to be taken to not Medicare, but to Social Security, because Social Security actually administers the eligibility and enrollment for Medicare. So that's why there's a lot to learn about Medicare, because who wouldn't think that if I have a Medicare issue, I want to sign up, I would start with Medicare. Well, you actually start with the Social Security Administration. Totally separate federal agency, but it's the one that handles your enrollment and your eligibility. Now, when people first become eligible for Medicare, it starts actually 3 months before your 65th birthday. That's when you actually can talk to Social Security. You can start to figure out what forms you need to complete. You can complete those forms and you can get those submitted. Also, the month you turn 65, you can still enroll in your Medicare coverage. And 3 months after your 65th birthday, you also can enroll. So this is like a 7-month period surrounding your 65th birthday that you're allowed to enroll. But what's really important to understand is if you enroll prior to your 65th birthday, your Medicare will start the first of the month of your 65th. But if you enroll the month of your 65th birthday or any of the months you still can enroll after that, your Medicare coverage will not start right away. So the reason that is so important to learn is because you don't want to end up in a situation where you have a gap between when one coverage ended and your Medicare coverage began. So very important to understand these rules surrounding the enrollment. Now, what happens after 7 months? What if you did not enroll when you were supposed to, which most people don't even know when? There are penalties. So very important to understand, if you do not enroll in Medicare when you first become eligible, you may be subject to penalties. That's why it's so important to learn. But if you are covered through a spouse, if you have coverage through a spouse who's still actively working, you may not need to sign up for Medicare. So again, there's no one size fits all when it comes to Medicare. So very, very important to learn as much as you can. Now, Medicare again, once you apply for Medicare, the first person again who received it was former President Harry Truman. He got a card that was red, white, and blue, and the card said Part A, and the card said Part B. So the actual parts that you get from the government, what we call original or traditional Medicare, consists of that part that covers hospital. This is a test, so you should all remember Part A covers hospital and Part B covers doctor visits and things like that. So the card that you get when you enroll in Medicare is going to just consist of Part A and also Part B. So if you want to pick up those other parts that we talked about, Part D or Part C, you will have to work with a private insurance company. A private insurance company that has a contract with Medicare, so they have to follow all of Medicare's rules. But very important to know, the A and B is the part that comes from the government. That's the program that was set up and signed into law in '65 and became active July 1st, 1966. It just consists of Medicare Part A and Medicare Part B. So again, for the other parts, you'll need to reach out to private insurance companies. Now, Medicare was never intended to cover 100% of the cost. When this program was started in 1966, remember, the price of a car was $2,600. A gallon of gas was 32 cents. So at that time, Medicare insurance was developed to help people, but was never intended to cover 100% of your medical costs. Now, a lot of people are very surprised at that, because many times when they've reached that beautiful age of 65, or if they qualify due to a disability, they may have a fixed income. They no longer may be working, they no longer get raises. Those are the things that we used to get, a raise in salary if we were working. So because they're on a fixed income, they're very concerned that healthcare costs can start to take up a big part of what they may have to live on. So that's why it's very important to understand Medicare, how to find programs that lower your costs, because Medicare is an insurance that you could end up being on for as long as you were in your working years. I talk to people frequently who have been on Medicare for 20 years, 25 years, 30 years, and even those people really tell me they have no idea how Medicare works, and they're just praying when they go to the doctor that everything will work out. So again, it's time to learn, because we're all living longer, so we could end up being on a Medicare even longer than 30 years. What a thought that is. Medicare also takes care of what's considered medically necessary. So if you believe that you need the Medicare to take care of something that's not Medicare approved or medically necessary, that will be something that you have to pay for out of pocket. Now, some people, as they grow older, they think that they, maybe want to have some reconstructive surgery done to make themselves look a different way. And Medicare does not think that that's medically necessary. So if you want to do those tummy tucks or Botox injections, you may have to go into your savings for that. And you might not want to look to Medicare to pay for that, because they don't. Again, Medicare coverage, once you're retired, no longer working, it is considered primary coverage. So if you don't pick up your Medicare, I've actually met people who don't seem to like the idea that they've turned 65 and they qualify for Medicare. And even when I tell them it's a very valuable benefit, they would like to know, is there another insurance that I can pick up? So I tell them, you are actually required to pick up your Medicare insurance, or you will have penalties. And even if you have another insurance, because Medicare is primary and pays first, it's very important to pick up that Medicare when you first become eligible. If you do have other coverage, Medicare again will pay first. The other coverage, like a retiree group plan or even COBRA coverage, will pay second. So if you do not pick up your Medicare coverage, then you may not have any coverage from your COBRA, continuous coverage, or a retirement coverage. So very, very important. Pick up Medicare when you first become eligible. Talk to Social Security Administration if you're uncertain as the best time to do that. And then prescription drug coverage. Remember, Part A and Part B do not cover prescriptions that you pick up from a pharmacy. So you want to make sure, if you only have A and B, you need to make sure you call Social Security or Medicare and talk to them about picking up that Medicare Part D plan from a private insurance company. Now, there's another plan called Medicare Advantage, and most people do get those all confused, but Medicare A and B are separate from a Medicare Advantage plan. Medicare Advantage plans are Part C plans, and remember, that brings everything together, your Part A, your Part B, and your Part D for drugs. So many times, if a person is thinking about figuring out how they can lower their costs, a Medicare Advantage plan might be the way to do that. Might. Again, everybody's situation is different. But when you pick up a Medicare Advantage plan, what you're actually doing is you're assigning your original Medicare Part A and your original Medicare Part B to the private insurance company. And now you have this Medicare Advantage plan, and there are certain rules that would be in effect. One of those rules is you must live in the service area. So if your friend in another state has a Medicare Advantage plan and they're telling you how great it is, and you want that exact plan, you cannot get that exact plan if you do not live in that zip code. So Medicare Advantage plans are determined by your zip code. Also, there are no age or medical restrictions. And in 2020, if you have ESRD, which is end-stage renal disease, you were prohibited from picking up a Medicare Advantage plan. But I'm so happy to report in 2021, they have decided that even someone who is receiving dialysis and has been diagnosed with end-stage renal disease, for the first time, they will be able to join a Medicare Advantage plan. And that's why it's so important to learn about this stuff, because things change and you want to make sure that you're getting everything you can out of your Medicare. And those you love who may have Medicare, you want to stay up to date so that they also can take advantage of ways to lower costs. When you have Medicare Advantage plans, they are separate from Medicare A and B, and often Medicare Advantage plans will give you more benefits than original Medicare. So people look at Medicare Advantage plans to get benefits beyond what original Medicare will make available to them. Also, Medicare Advantage plans can be structured as what's called HMO accounts. That's Health Maintenance Organization plans. Those plans require you to select a primary care physician, and whenever you need any type of attention, you need to first visit your primary care physician, and then that primary care physician will refer you out to any specialist that you may need to see. Now, during these pandemic times, many of the Medicare Advantage plans are allowing you to have what's called telehealth visits. So you can contact your insurance company. They'll tell you how you're able to access your doctor or a doctor using telehealth. That can be by phone, iPad, desktop, laptop. So there are many ways to get access to medical care now under Medicare, and these are all brand new that are really as a result of the pandemic. So make sure you take advantage of it. So if you need to see your primary care doctor because you have an HMO, try telehealth as a way to do that. Then that doctor refers you to a specialist. There's another type of plan called a PPO, and with PPOs, you can select any doctor that takes Medicare. You may pay a little bit more out of pocket if that doctor does not have a contract with your Medicare Advantage plans. So that's another very important distinction. Some people, I will ask them, oh, what kind of Medicare plan do you have? And they say, oh, I have Medicare. And I say, well, do you have an HMO? Do you have an PPO? Do you have a totally different plan called a Medicare supplement plan? And most people do not know. Some people do not even realize that their Medicare Advantage plan covers their prescription drugs. So very important to learn these things so you can have a better understanding of exactly how your plan will work. Now, Medicare annual enrollment periods, those roll around once a year, and those are for people who already have Medicare. If they have a Medicare Advantage plan, this is the period of time that they can change their plan. They can see what's coming for the new year. They can decide if they're happy with the plan they have. If not, this is the time when they can change to a new plan. That period begins October 15th and it ends December 7th. So there's a lot of TV advertising, and many people, this is another time where they get very confused. So I tell them it's so important to make sure that if you're happy with the plan that you have, you don't need to make any changes, but if there are changes out there and they look like you can get more out of your Medicare, October 15th to December 7th is the time that you are allowed to switch. And that switch will become effective January 1st. So make sure you understand if you change a plan, it's not going to take effect immediately. Now, what should you do each year during annual enrollment period? You should compare your plan changes for the new year with your existing plan. Every insurance company that offers Medicare Advantage plans is required by Medicare to send you that annual notice of changes. Again, if you're happy, do nothing and your plan will continue. But it is always a good idea to make sure that your doctor is still taking the plan that you have, and also any medications that you have are covered. Another common question with people, what about the mail? They get so much mail from Medicare, from insurance companies, and most people do not know what to toss and what to keep. So what I encourage people to do is open your mail. If it is a sales advertisement, it is supposed to be stamped sales. So if it does not say this is advertising material, and you know this is an insurance company that you've been working with, might be a good idea to go ahead and open the mail. And if you have some questions, Everyone should have their insurance card with a phone number on the back, which is to customer service, and you should contact customer service and let them know, I have a letter and I'm not sure exactly if I need to do anything with it or I can toss it. So they can tell you what to do. Many of the mailings take place in the middle of May. Also, there are annual notices that go out in September to tell you what's going to be new for Medicare in the next year. And in September, there's also a lot of information that's mailed. So those are the critical months that you can expect to see a lot of material. As we just take a look at some final thoughts, I believe that this is really a good time for people to start to learn about Medicare health coverage. Why? Because again, right here in Hawaii, we have over 250,000 people that are Medicare beneficiaries, and I can tell you every day more and more people are turning 65. It's important to understand what is covered and what is not. Many people think that if a person needs what's called activities of daily living, nothing medical, but maybe this person is bedridden and they cannot get out of bed, they think that Medicare will cover the cost of them being in some kind of a facility to help them, but it does not. So very important to understand that, so no surprises. You also want to be aware of the out-of-pocket costs. Even when you have insurance, some people think, oh, I have insurance, I won't have to spend anything. But financial planners are now preparing clients for insurance premiums. That's the monthly cost of the insurance. They're preparing them for premiums and cost sharing during your Medicare years. We track those years starting at 65, well past 90 now, but definitely through your 90s, and it's projected that 65 to 90 years of age, you will spend $295,000 in out-of-pocket costs for your health care and your drugs. That's for someone turning 65 today. So I always tell younger people, you know, you want to make sure that your parents, grandparents are getting most out of your Medicare, because if they don't, then you might have to help them out a little bit, cover some of those costs for drugs or health care, or they might have to come and live with you so they can save on some costs. So we talked about a lot of things today. Again, Medicare, I tell people you don't get it in one sitting, and I wanted to make sure I put some resources down for you to learn more about Medicare. So there's medicare.gov, that's the website, and then there's the phone number you can call, 1-800-MEDICARE. They're available 24 hours, 7 days a week. With the exception of certain holidays. And then you can also contact Social Security at 1-800-772-1213. That's 1-800-772-1213. And you can visit them online at www.socialsecurity.gov. I want to thank you so much for your time today, letting me come into your home and talk about my favorite subject of all, which is Medicare.